Welcome back to the second segment of Solace Show. I am Dr. Robin Donaldson, the host, and this time I have with me the Capsars. Paul, that one's Paul, Kelly, that one's Kelly, and they will tell you a little bit of what they do, and then we'll get into how it relates to grief and solace. Which one wants to start?
She can.
Okay, all right, Kelly, it's all you.
Good morning. Thank you for having us here.
Of course. They're married, by the way.
We are.
Yeah.
So, I've had a history of trauma and grief, and I've spent the majority of my life working to heal myself and learning ancient and contemporary ways to do that for myself and others. Professionally, I'm a licensed massage therapist. I'm a craniosacral therapist. I'm a licensed spiritual practitioner. And that's kind of what I do. I know that there's ways to help people get out of grief, move it out of bodies, move it out of minds, move it out of spirits, and I think what Robin, Dr. Donaldson is doing with the Solace Club is one of the most amazing things I've seen for grief, as far as something tangible. And I know we've sent a bunch of these boxes to people, and it's been very beneficial.
Good.
And what happens after that too.
Right.
So that's kind of why we're here.
Excellent. Well, thank you so much for joining today, and I agree. Flowers aren't enough, boxes aren't enough, and part of having the show is reaching more people to explain ways in which we can support people in grief even more. So thank you for being on. All right, Paul, what about you?
I'm Paul Capsar. I am a nurse practitioner. I've been in healthcare since the age of 17, so you can tell it's at least a week. And during that time, I was a hospital orderly. I worked in the ER. I worked in the intensive care unit. I was in the Army Reserve. I did emergency preparedness. And I pretty much touched on most aspects of healthcare. And I have seen, starting at age 17, when I was an orderly, we had a doctor who refused to tell a patient that she had a terminal diagnosis because he couldn't deal with it.
Wow.
And even at age 17, I thought that was pretty...
Not okay.
It wasn't okay at all. So it sort of set me on my route of, I started an ethics committee at a hospital. I really have opened up working in the ICU, how to deal with grief in the ICU. When you work a long term with the ER and ICU, I've calculated one day, and probably many ER nurses, ICU nurses have got similar, but don't think about it, is I have probably been on somewhere in the neighborhood of 2,500 cardiac arrests. And if you know anything about the statistics, only about 3% of those people survive. So I've been present at a lot of events that cause grief. Some expected, some traumatic. So I've been dealing with grief for quite a while.
Wow. And now what do you do?
Now, Kelly and I are in our same office, in the office together, and most of my work is wellness. I want to get you to the point of where you can move forward, not deal with the physical aspects of things, because many people take their grief and they eat it, for lack of a more elegant term, and you find it in different parts of the body. And we help by a number of different routes to get that out of your body and get it gone so that you can work with it.
I know one of the things that I wanted to get a sense from the two of you that we haven't talked about, off camera, on camera, is how grief presents in your patients. When folks come into your office, you talk a lot about grief in the body, and so I'm wondering, where does it hide in the body? How do you know it's in the body? Are there other things that folks in grief present with? Just kind of curious with your experience what that has been like and what you can share with us.
I'll take that one first.
Okay.
So what I've seen in my practice in the last 6 months in particular,
Mm-hmm.
and before that, and it's enhanced in the past 6 months, I'm having a lot of people show up with hip and leg issues. I had a rash of broken ankles. I have a rash of sciatic problems. And in my world, sacrum's the triangle bone at the base of your spine, store and process, among other things, stability and spirituality. And I define spirituality as any kind of time we have a faith crisis. We're not who we thought we were. Our parents aren't who we thought they were. A higher power, whatever you call it, isn't what you thought it was. Anytime there's any kind of faith crisis, people aren't what you thought they were.
Right.
It shows up in the sacrum. Psoas are two muscles that support the pelvic girdle, and they've been called the most significant muscles in the body because of supporting the pelvic girdle. And if your pelvis is out of line, your internal organs, including your heart, including your lungs, including neck and shoulder, are either going to get stretched or squished, neither of which is good.
Right.
And also you can mention back pain
Right.
as part of that.
Right,
That
and
would
that's
be
one of the
part
more
of it, yeah.
obvious. And then in traditional Chinese medicine, the meridians and the organs represent and store and process different emotions. So liver and gallbladder store and process anger, and the gallbladder line goes from the top of your head to the bottom of your feet. The liver lines are the inside of the legs moving up to the chest. And what I'm seeing right now is people are coming in and saying they're overwhelmed, they're feeling depressed, they have no idea, they know they need to chill something out.
Mm-hmm.
And so they come in for body work because they haven't seen what they're doing isn't working. So they're either coming in overwhelmed and anxious, or they're coming in with a lot of hip and leg stuff. And hips and legs are about moving forward. And if we're carrying anger, which is, so far as I can tell, anger is easier to deal with than actual grief, because we can focus our attention on something instead of how much it hurts.
Mm-hmm. It's one of the protective emotions.
Right. So I'm seeing a lot of people coming in with more anger kind of symptoms right now.
Mm-hmm. Mm-hmm.
And when people are in full-on grief, not so much the anger part, it shows up in low backs, it shows up in neck and shoulders, it shows up in people having a lot of allergic responses and respiratory stuff and digestive things.
Interesting. Okay.
Welcome to my world.
I learn all the time on this show, which is fantastic. I love it. Okay. All right. And what about you, Paul?
So what Kelly's telling you is that it really is a total body response. What I find is, even all the way back, part of my practice has to deal with addiction. And I find that people who have been abused, whether it's physically, mentally, sexually, or in whatever manner, at a very early age, lose their personal sense of self or self-security. And as a result, they use substances to take that out so they don't have to deal with it. And they also, it happened long enough ago for some of them it's a relatively recent trauma, that they buried it so deep they don't even recognize that's what it is. And part of my thing when I guess the bad habit that I have as a professional that many typical Western providers don't have, or my bad habit, is I listen to people. And
Yeah, that will get you in trouble.
it really does. And by listening to them, and I put a bunch of different pieces together, and I will say, well, what about bang, bang, bang? And they'll like, oh. And then once they understand what's there, then it opens them up. What do? I'm not one who uses, I'm actually, we got the opiate crisis going on. My belief is the next thing we're going to have to deal with is a benzodiazepine crisis, the Valiums, the Xanax, all that kind of stuff. Because if you're in grief and somebody gives you Xanax, so you got grief, your grief spikes, and you take Xanax, it flattens out. There's no way to work on anything. So I use something off-label that I won't describe here exactly, but I call it the mountain chop topping medicine, that you take that anxiety, you chop the top off of it, and it takes all those severe things away, but you can work with what's underneath it.
Right.
And by doing that and changing their responses, but still giving them something to work on, they have a chance to work through stuff. What else do I don't use? A lot of antidepressants. I use vitamins. Most of us, even though we live in Vegas, don't have very good vitamin D levels. Vitamin D is very important in preventing depression and things like that. I work on foods. If you're not eating the right foods or you don't have the right basic level of vitamins in your system, you don't do well. So I work on those sort of things. We do have a counselor next door if I need them, and most of what I've learned that's really beneficial is I send them to Kelly, because Kelly works the stuff out of their body almost literally, and we also put them in the pool to do aqua stretch. It loosens up a lot of things, and we change their perception of the world. The other, and I think you got copies of it, was the Ho'oponopono.
Yes.
Ho'oponopono is an old-time Hawaiian self-forgiveness meditation. And I got it from Kelly because, she's the one who has that woo-woo stuff. But I find out that the woo-woo works better than some of my medications. So I'd much rather go that direction. So we do a whole different blend of things in our office than what most providers do.
Yeah, and one of the reasons that I wanted you on the show is because of your holistic approach and my experience with grief, as well as my experience with a lot of things in life and with mental health and just any dis-ease in the body, is that it starts at the top and goes all the way down to the feet. And with grief in particular, I can identify so many disruptions in how your stomach works, being, and so that then impacts your appetite, your body, you hold it, your chest may feel tighter, you may have a difficult time breathing because your chest is so tight, neck muscles, all of this makes intuitive sense. And yet when we are grieving, we just think, well, I need to get through, the funeral. I need to get through, this next thing that's right in front of me, not really thinking about, and then self-care, what is that going to look like? And so in just conversations that we have had, self-care is everything. It needs to deal with the entire body. And that is what I really like that the two of you do, is that you work on all these different bits and pieces. Now, you had mentioned 6 months. You've been seeing this influx of people in your office within the 6 months. Why the 6 months, do you think?
Starting in August, we had 7 weeks of unprecedented events in this country. We started with the floods in Houston. We ended with the fires in Santa Rosa. We might have had an event here in Las Vegas. Maybe.
That October one?
Maybe.
Yeah,
Maybe.
Yeah, that was kind of big.
Yeah, kind of big.
Really impacted us. Yeah, absolutely.
And what it feels like to me is that people's safety is threatened. People are feeling more anxious. Nervous systems are completely overwhelmed. And so collectively, we're sleeping less. We're getting crazier on the roads. We have shorter tempers. We're coming down with, flu symptoms that are kind of crazy. We're having some of the biggest allergy things going on right now.
For sure.
Right? we don't feel settled. And part of it is, so far as I can tell, is that we're grieving all of the things that happened that changed our sense of security. And particularly with what happened here, we don't have a focus. We can't say that there was mental illness. We can't say any of the usual things. We can go, oh, let's get behind that. And so it's creating a greater underlying stress. And every single person I've talked to, not only collectively has had those experiences of grief and trauma and, you know, mudslides in California and whatever, and that's just here, but every single person I've also talked to has had an individual spike of something that is changing their life. And we just...
And that makes a lot of sense. When we think about grief, a lot of times, and especially in this show, we talk about the death of a loved one. But collective grief and grieving the loss of our sense of safety is huge. And the impact of that can have a cascading effect. So even if you didn't know anybody that was at the concert, you still recognize, oh gosh, that could have been me. I could have been there. This was in my backyard. This was my hometown. And any one of the unfortunate events that have happened within our country, within the world, there's a part that says that could have happened to me. And the closer to home it is, the greater the impact. And it does hit things like our immune response. It hits our normal reactions to things that we may not recognize it, but that'll impact our health, it'll impact our mood, and we just think that we're in a funk, or we think, oh gosh, I just caught this bug, even though you may not have been sick in the past 5 years from any type of bug or flu symptom. So I agree. I definitely think that we've all been impacted by these things, and we are not super awesome with dealing with grief.
No, we're not.
No.
We're not. And then you get people, local folks that had a loved one that was at the October 1 event, and they have, let's say it's a teen who has just launched, and now they've got a severe injury, and mom and dad are back being caregivers for somebody that can't even move. And I've seen that with a number of folks, that not that I've seen personally, but you look at the news, and there are people who were doing wonderfully, and I mean, you know, they're out dancing at a country concert. That's pretty intense.
Right.
And now they're disabled, and they can't even do the basics for themselves.
Right.
And your whole mindset has just gone from, okay, I've got, you know, I as a parent can now be off here doing what I want, and now I'm back to being a caregiver. Or, you know, your loved one who your spouse got injured, and now they're disabled, and holy smokes, look at the workload that I've got.
Right.
And then you've got the diametric opposites of, I really love this person, but holy smokes, can I do this? And where am I in the process?
Right.
And it's a horrendous place for people to be, and they won't, and a lot of them won't acknowledge that they're having this. Well, they're my loved ones, of course I have to do this, but I don't want to do this. And there's a very difficult time for them.
And that happens with anybody who gets to become a caregiver unexpectedly. You know, somebody's diagnosed with cancer, whatever the conversation is, if we become caregivers unexpectedly, or even expectedly, maybe somebody's got MS or you know, whatever, and it's degenerative, and so you know it's coming, there's still that grief piece about, how do I do this, and how do I watch my loved one go through this, and we really need to bring it back to self-care, because if we don't find that moment of peace for ourselves, if we don't find that moment of centeredness for ourselves, we're just, it feels like we're just going to get beat down, and individually and collectively.
And that's why I've really started offering, or making sure people are aware that, you know, one of our jobs, or we've taken on, is caring for the caregiver. Having spent 20 plus years in deep in trauma response, deep in preparations for trauma response, working in the intensive care unit, I can tell you, when they talk about getting fried from working in that environment, it's not a silly thing. It's real. And I'm prepared for it. I've got, credentials for all those things all over the place. But if, you're not prepared for it, or even if you are prepared for it and you're in it 24/7, you got to break some time out for yourself. If you don't take the time for yourself, the person you're caring for is not going to do well.
Right.
You have to get them, you have to get a break. And whether it's coming to visit our office and land the biomat and don't do anything else, okay. If you want some guidance on how to get through things, wonderful. If it's a matter of, we now have someone in the office that does Reiki. If you just need your energy shifted, we'll be happy to help with that. Yeah. But we have the skills, we have the ability, and I've been there. And I know what it takes to pull back from that abyss, because sometimes it feels like an abyss.
Sure.
And so we know what you need to even think about, or what questions to ask you that you've been buried that you haven't been willing to talk about.
Well, and professionals, I can give my personal opinion or experience. We never got a class on self-care or being a therapist, caretaking in a way, because that's what we do. How you're supposed. We were encouraged to engage in self-care, but not a lot of direction of what that would look like, or hey, we're going to give this to you, or this is how you implement it in your daily life. So as a professional, we weren't trained, and yet so many people who are not professionals end up in the caretaker role. And so I love the fact that you're offering this, because when you think about somebody that is just breaking their neck trying to take care of their loved ones, and that they need something, they need a respite, they need support, you're not really sure how to provide that, and your office does that, and I think that is fantastic. So I thank you for that gift that you are giving out there to the world as a service, for sure.
Thank you.
Yeah. I did want to pull up their website so that we could take a look there. Please and thank you. I think we'll be able to see it. I put up there on the membership pieces because I was all excited about the new membership stuff, and if you wanted to talk about that for a little bit.
Oh, the membership, basically, we all know that the insurances today are a little challenging, and that many times there's a high deductible. This is a membership plan. This is not an insurance plan, but for less than what the typical deductible is, we can offer you the availability of someone to provide care for you, kind of I won't say an unlimited basis, but a pretty open basis. The initial cost, we have to do an initial assessment and lab work, and we have an initiation fee that's currently $200, and then we charge $75 a month for the first year as a contract, and then after that it's a month to month. But you can come in to see me as you need. We have some aqua stretch available. We have, if necessary, if you've got some painful issues, we will make a connection with Kelly and get you to see her for the massage or craniosacral therapy. And so we have a wide variety of things, and we have Reiki is also part of that. So we have a lot of different things to offer that we don't have enough time to spend all the time talking about it. But it's an open process, and we listen.
Absolutely, and if you're in Vegas, definitely a place to check out. Knots Unwound with Kelly and Silver Arc with Paul. The Silver Knot, I like how you combine those two together, .us. So I know that we're wrapping up here towards the end of the segment. I wanted to thank you both so much for being on Solace Show and talking not just about the wonderful things that y'all are offering and doing to really help folks, but your own personal experiences as clinicians as it pertains to grief and caregivers. Just thank you so much for all the work that you've been doing. Thank you.
Thank you for the invitation, and thanks for creating that cool Solace box.
Oh yeah. You are definite supporters, and the more input, the more synergy that we have with people trying to go towards the same thing, I think the better able we all are going to be at being able to support those that need it the most. So thank you all so much, and I hope that you have a good rest of your day, and we will see you next month in May.
All right.
Bye.